Hi, everyone. It's Dr. Azi here. Welcome to the More Than a Pretty Face podcast. Hi, everyone. Welcome back to the More Than a Pretty Face podcast. I'm your host, Dr. Azadeh Shirazi, a board-certified dermatologist, and I'm here with Lacie, my co-host. How's it going?
Good. How are you?
We are continuing our masterclass in
Yes.
learning all about skincare regimens, foundations, but I'm super excited about this episode.
Yes, we are talking all things retinol, discoloration, skin cycling, skin flooding,
Skin
all the
flooding. People
trends.
come up with the coolest names. I'm super excited. Let's get started.
Yes.
So last episode we talked about how to build a skincare regimen because I really feel for the consumer. We're just overwhelmed with so many products, but how do you put everything together? Because it's actual regimen in its entirety that really matters. It's not a brand, it's not a product, it's not, what your friend is using. It's really creating a customized regimen that works for you, your skin type, your skin concern. So if you didn't listen to the previous episode, go back and listen to it because it's important to have a really good foundation. And obviously, not everybody can go into a dermatologist and sit down and come up with a regimen. So
Right.
this hopefully will be a guide for you to follow and help you in building one.
Yeah, I mean, we're answering all of your guys' questions.
Yeah, so we're going through our 100
yes.
questions.
So,
Okay.
here is again just a sample of all of the questions. I promise we'll try and keep it organized this time. We're talking about hard water filters for acne prone skin, what retinol to use. Can we apply moisturizer straight after a retinol?
Okay, but wait, I want to answer the questions.
No. Okay, let's dive in. Let's
Let's
dive in.
talk about hard water for acne prone skin because I had a patient come in the other day and she was convinced that her acne was caused by hard water.
I remember this.
Yes,
Yes.
and she was so convinced. And yes, hard water can contribute to skin conditions, but it may not be the only cause. In fact, there was a study done in the Journal of British Dermatology, and they looked at adults and their eczema state in areas of hard water compared to areas that didn't have hard water or filtered water. And it did show that the prevalence of eczema was higher in people that had access or were using hard water versus ones that were using filtered water. But it didn't show an increase in incidence, which means that it's not really going to cause your eczema, but it will be a factor that will contribute to it. It will make it worse if you have it already. And same
That
goes
makes
with
sense.
acne. So why does hard water potentially make acne worse? Let's talk about the science.
Yeah,
'Cause
well,
I
it makes
love
your
talking about the
skin dry
science.
when you get out. I
Well,
know
yeah,
for me.
but hard water is high in magnesium and calcium, and that can cause a buildup of residue on the surface of the skin. But
Oh,
more importantly, it can also create this like coagulant, this waxy sort of plug that can
interesting.
clog your pores potentially and make that worse. And if it does dry your skin out a lot, then yeah, it could affect your skin barrier, which could flare your acne, your eczema, and any skin condition you possibly could have. But the areas of highest hard water in the U.S. is actually the Southwest.
Oh,
Yeah, so you can check your hard water. They do have little kits, in the um, in available online to purchase. But you got to be careful with taking it. Acne is kind of complicated, so it may not be the only reason.
very complicated. Let's dive into retinol.
Yeah, let's do it.
Is
Some of
it?
my favorite. You want to know what? You want to know what type of retinol?
I want.
There's
I mean, it's
retinol is
your
such
rock
a huge
star,
topic.
right? It's your
Well,
rock
last
star
episode I talked about
ingredient.
the reason retinol is the OG of anti-aging skincare. But in terms of what retinol is, it's a vitamin A derivative and it binds to the skin's retinoic acid receptor, and that's where all the magic happens. Now, prescription tretinoin, formerly, known as Retin A, is the most active form. So that is what actually binds to the receptor. So what about all these retinols that you hear on the market? There's like retinol, there's retinal, there is retinol palmitate, there's all these different forms. And then there's, percentages of retinol. So if you're looking at retinols like you would look at tea, okay, so retinol palmitate is sort of like the green tea, the chamomile of retinols that are over the counter, because it has to convert, 3 steps to get to the active form.
And is that like drugstore over the counter?
Yeah, so
Okay.
it could be bought without a prescription. And then the next one would be retinol, and that would be sort of like the black tea. And then if you're looking at, a more potent version, which would be an espresso, that would be retinaldehyde. And then the prescription form, retinoic acid, would be like a triple shot of espresso, right? Because that's
Okay.
like the active form that
So there's
binds to the same.
4.
So yeah, there's all these actives have to convert so many steps to get to the active form, which is retinoic acid, aka tretinoin, retin A, that's only available by prescription. So if you're looking at something and it says retinaldehyde, that is the most effective or the most potent form, because it only has to convert 1 step to get to retinoic acid, which is the active form. But retinol has to convert 2 steps, and then retinol palmitate has to undergo a lot of steps. So it's not going to be as potent, which could be a good or bad thing. It could be, if you're just starting out, you might want to start with a retinol palmitate, but I don't know how much retinol palmitate does, honestly.
Can we?
I would go for a retinol or a retinal, which is retinaldehyde. So yeah.
So in English, for our listeners, we're talking like
But that's just
over the
basic.
counter, like just basic meh retinol, or you can do like medical grade retinol.
So medical grade is a marketing term, right? It's just like people throw that around, but
Oh,
um, it's a vague term, okay? Vague term. Medical grade to me means there's science and research behind a product. It's been, done trials on it and so forth. But when people say medical grade, they say, oh, it's a medical grade. It's supposed to be more effective or
yeah.
more potent. No, it shows. It should be that it shows, there's actually research that to back up the product. So it's kind of like clean beauty, like it means different things to different
Got
people.
it.
But it gets more complicated than that, guys.
It sounds complicated, you
Because
guys.
then there are retinol formulations that are formulated, for example, with glycolic acid that makes it more, like Alpha Ret, for example, or Lift and Renew that's combined with bakuchiol that makes that retinol even more potent, even though it's a retinol and not a retinoic acid.
Okay, so let's just break it down. Okay, let's be a little more simpler with this for people like me. When you're starting out, like what should you use?
Well, I would suggest using it only at night and apply it every other day or
But
every
which
other
one?
night. Which
Which one?
retinol you should
Yeah,
use?
if you're starting out, I don't know.
I mean,
Did I literally make you
which
pause?
one?
Did you literally have nothing to say right now?
Because there's so many great products. I mean, you could start with prescription tretinoin. You could start with Lift and Renew, which has been shown to be as effective as
Okay, so
prescription
it doesn't
tretinoin.
matter. You shouldn't you don't have to work your way up, is what you're saying. Like start with whatever.
I mean, I can't tell a gazillion people what I mean. Okay, so I'll give you one of my favorite drugstores. Okay, if you're looking for an affordable drugstore option,
Okay.
Rock is the OG of retinols. They were the first ones to make retinol. That's a good one.
Okay. Okay.
If your skin is, a little bit more resistant and just can take a lot of different, products and is not sensitive,
Mhm.
I love Alpha Ret I think Skin Better Science. Alpha Ret is great.
Okay.
And if you like kind of like a hydrating, oily sort of consistency, I love Lift and Renew. It's what I use. It gives my skin a nice glow. That actually has a lot of science behind it, and it has bakuchiol and retinol, and it's equivalent to prescription tretinoin 0.025%. If you get in and see your dermatologist, ask them for a prescription for tretinoin or retin A. My favorite prescription is our office prescription, which is Renew RX because it has niacinamide in it. But if you don't have access to that, then Altrino is a great prescription retin-A. So does that
Yes.
answer the question?
Yes.
That's
Thank
what
you.
you guys want to hear.
Now,
All right.
no matter what you are using, how do you start out using it?
Every other day to start, only at night, every other
Not
night,
in the
because
morning.
retinol gets deactivated by light, even visible light, actually, for 2 hours. It gets deactivated by sunlight and visible light. And then you want to wait to apply it after cleansing. So here's what I tell my patients. I say, break up your skincare routine at night into 2 phases. You've got an early evening phase because as soon as I get home, I just want to cleanse everything off my face. It's like my ritual, right?
Yes.
I want to take the day off. I cleanse and then I immediately moisturize because that is the best time to seal in moisture is right after cleansing. And then I wait. I wait hours, till 9, 10. And when I go to bed, when I'm going to bed after I brush my teeth, that is when I use my retinol on its own because I feel like your skin is primed, ready to receive that powerful active, and it's at bedtime, so it's a superstar. So you want to use it on its own. You don't want to use it with a bunch of other products. So that's how I tell people to do it. And then when you're applying your retinol, a lot of people apply skincare like this. They go like this, like from the inside out. You can't see it if you're just listening, but watch it on YouTube. What you want to do is apply it from the outside in because guess where you get the most irritation and dryness from retinol? You get it around the mouth, around the nose, in the central face area. So you don't want to start off putting, a big glob of it there. Dab a few areas on the outer cheeks and then rub it in towards the center of the face.
Interesting.
The other trick is you can add a protective ointment like around the eyes, the creases where you are prone to getting dry before you apply your retinol because that ointment, you can use like Vaseline, for example. That ointment will create a barrier so that the retinol won't get concentrated in those areas. And be sure to wear sunscreen. That's really important
every
in the morning.
day, regardless.
Yeah, you don't want to do all this work.
So don't put sunscreen on after your retinol.
Well, you should never use retinol in the morning, right? Because it gets deactivated. It's not going to work. So you should only use it at night.
Okay, I really, really, really want to talk about the trendiest thing
and
right
then
now.
if you really want to learn even more about this, watch my YouTube video, Retinol 101.
She's got a video for everything, you guys.
I know.
So
skin cycling.
Yes.
Can
we talk about this? This is so big right now.
She coined it. My colleague, Dr. Whitney Bowie, which we need to have on the podcast.
Yes,
we need to invite her on. She's my colleague, a dermatologist out in New York, who started the skin cycling trend.
I love this.
Which is just all the rage. And so let's talk about what skin cycling is really. What was it designed for? It's really a guide, especially if you're starting out using actives, and it simplifies it in a sense that it tells you what to do on what night. So the first night, you're going to exfoliate. The second night, you're going to use your retinol. And then the third and fourth night, you will just skip your actives and just restore your moisture barrier.
Just gentle.
Just, your skin's going to take a break. What the exfoliant does is it kind of primes your skin to be able to have that retinol penetrate into your skin better.
Okay.
And then you have your retinol and then restoration, which is really clever. And it's something dermatologists have been doing for decades and decades, but she actually coined the term and she marketed it and made it a thing, a trend. And we know people love trends because it sort of makes people aware of a certain way to do things. Now, I think it's great if you're starting out using exfoliants and retinols and some of the more powerful active ingredients. I'm not a fan of skin cycling long term.
Okay.
Unless you have sensitive skin. The reason being, in order for retinols to be effective, if you want to get the maximum benefit and all the, jazz that comes with it, you need to use it at least 5 times a week. So with skin cycling, you only end up using it a couple of nights a week. And to me, that's not enough to really retinize your skin. And we talked about retinization of skin on the last episode, but you really do need to use it 5 times a week in order for it to be effective. So that is, people always ask, what do you think of skin cycling? I think
Yeah.
it's great. It's a great way to start it, but I don't think long term is a good
So if you are
solution.
already a long-term user of retinol or Retin-A, and then you want to do skin, like, would you benefit at all from skin cycling? Like if I decided 1 week I just
It
wanted to do skin
benefits.
cycling?
Yeah, I think it's beneficial if you're getting irritation
Got it.
or if you're
Okay.
starting out. But
Okay.
you only need to exfoliate once a week,
Mm-hmm.
maybe twice a week. And on those nights, you just skip your retinol.
Okay.
To me, it gets confusing
It
too. It's
really,
like,
it's a lot.
what did I was last night my
Yeah.
resting night, or was it my retinol? I mean, I
Mm-hmm.
can't even keep track what I do that day.
You just need a
So,
calendar, I guess, on
so
your mirror.
I just, once a week, Friday night, I skip my retinol and I apply my exfoliant instead, and that's it. So,
So I love this. I'm just like obsessed with these questions, you guys. And so I want to talk about skin flooding.
yes, another trend, skin flooding. So, what
Mm-hmm.
is that? I love how
I
people come
want to
up with these
know.
names. It's like something we've been doing over and over and over again, and but again, somebody coined it. So, what
Yeah.
that means is you're layering products to maximize skin hydration, which means you're going to apply thinnest to thickest. So you're going to go, mist the skin
Mm-hmm.
with a thermal spring water,
I
right?
do every morning.
Then while you're feeding your kids and
Yeah.
and then you're going to apply a serum, which are water based, right?
Okay.
And then you're going to apply an occlusive moisturizer,
So
something
it's
that's heavy.
slugging.
So no, not slugging. And so that kind of sort of seals in that hydration you just did.
Okay.
And then if you want to slug, you'll apply thicker, like only like an occlusive, like Vaseline on top of that. So you see, it's
Okay.
like, you go from thinnest to thickest to really first mist and hydrate the skin. Then you will, seal it in with all these other layers.
So I'm already doing this every night then.
Well, are you?
Yeah, I mean, it sounds like it. I'm doing
Well, that's
my
why I say,
mist. I'm
yeah,
doing my serum. I like
good.
skin tight at night. And then I'll
Yeah.
do my restore, which is a thicker cream base like moisturizer.
So yeah, you're already doing
Right?
it.
I'm
Yeah.
just not putting the Vaseline to slug. So,
Yeah, you don't need to slug unless, you want to, maybe once a week, slugging. So yeah, I think it's a great thing to do. That's why I like having my cleanse and my hydration step earlier in the
Mhm.
evening, like 6, 7 p.m. And then I use my retinol on its own at the end of the night because I want to
Yes.
go in using the retinol, my skin well hydrated, but that's hours later.
Yes.
So
Yes. Great. I love trends. All right. Well,
that was fun.
that was so fun, all about anti-aging, but now our biggest most popular question is everything discoloration. Like,
Yes, hyperpigmentation,
yes.
discoloration. Yeah, that is a big one because
Mhm.
now is the time where we are seeing a lot of brown spots, a lot of melasma flaring up
Mhm.
right in this, in the middle of summer. Speaking of, I have a patch of melasma coming
No.
back from my trip.
Are you
I know.
pregnant? Did you come back
No,
pregnant?
no, but I will tell you, I tried to laser it and it
No.
did not work.
You know better.
I know. Well, I wasn't sure what it is because it's the tiniest patch, right? But I see it and I'm like, oh, that is a sunspot. It is not melasma. It is not melasma. I'm going to laser this baby off. And guess what? It
It's
didn't
worse.
work. It didn't work. So that's the thing with melasma. If you suffer from this condition, it is really annoying and it can
Mhm.
really affect your confidence. I
Yes.
feel for the women who struggle with melasma. And one of my favorite things to treat in my practice is melasma, which is why I created a program called Skin Bright, which uses a prescription regimen routine that really clears melasma. Because as you may have noticed, lasers, sometimes peels, they may work for a week or two, but boom,
Mhm.
it comes right back. So you really need medical therapy. And I think that's the thing a lot of people don't understand is melasma is like the diabetes of dermatology. It
It
is a
really is.
chronic condition and it requires a prescription regimen by somebody who has a lot of experience and truly understands the disease in
Mhm.
order to clear it and then keep it cleared. So
Yes.
that's the trouble with melasma. So we see this mostly, in San Diego because we have sun year round, but
Everywhere.
it gets particularly
Yes.
worse in the summer. It's really important for you to avoid sun and heat.
So hard out here.
So hard in the summer. When I say sun, I mean throughout the day because it is exacerbated by not only UVA rays that are out all day, they don't just peak, midday, they're out all day, but also by visible light. And that's is what a lot of people don't understand.
Our
It comes through
devices.
windows, your
Of that too.
screens,
Mm.
put off visible light. So it's really important to use a moisturizer with SPF that has iron oxide. And the Hydrotemp BB was designed for my melasma patients because it has the mineral-based SPF and it has the iron oxide to protect against visible light. Because
Mhm.
not only do you need a broad spectrum sunscreen, but you also need one that's tinted that protects your skin from discoloration.
Yes.
So, where am I going with this
Well,
now?
I mean,
I
you've
feel like
answered so much already. I mean, the different treatment options for discoloration. I mean, for me, when I was when I was pregnant, it was when I started with my melasma journey. Thanks, Remy. I after my pregnancy used the Dermabrite pads, chronically used my BB cream and my Illuma-C.
yeah, and it's really important to like hats, reapply your sunscreen because no matter what treatment you're doing, if you're not really cautious with sun protection,
Mhm.
it can really get worse. Have you seen those little visors that people wear, that kind of those shields that
Shout out to my
come?
patient because I
Yeah.
swear she has such difficult melasma, but she comes in every appointment with this big round hat, big glasses, and the hat has a mask that like drapes over her.
Yeah.
Literally, I have never seen anyone so dedicated to preventing her melasma.
Well, there are also these silicone like stick-on sheets that
What?
I've seen on the Korean or Asian markets because they have a large population of melasma in their country, and it looks like just, like a sheet you stick on the face
And
and it
that
blocks.
protects?
Yeah. Yeah. So if you go outside, they wear these, these sheets.
Interesting. I've never heard of that.
In the in the Islamic countries, you see the women that just show their
Mhm.
eyes. I
Mhm.
bet they have the most amazing skin
Yes, yeah,
under their
absolutely.
burqas.
Yes. I love that.
Okay, so moving on, what else you have for me?
I would love for you to explain if melasma is preventable or if there's certain like times in your life that you're more prone or susceptible to it.
Yeah, that's a great question. I mean, genetics plays a huge role, but so does estrogen. And that's why we see it mostly in females. So if you're on birth control pills, if you're pregnant, if you're taking, any sort of hormone like that, it could make it, more likely to show up.
Mhm.
And it does happen usually in our 30s, 40s, in the older decades, but it could come up really at any age. Certainly the amount of sun you're getting. So that's why I say San Diego is like the worst place to live if you've got melasma.
Mhm.
But sometimes it's not, you can't prevent it. And the best treatment is really finding a good dermatologist that can manage that condition because like I said, it's one of those things that it doesn't just go away with with one laser treatment. So
Mhm.
in terms of what products you can use, so let's talk about the ingredients. Well, hydroquinone is a big one. A
Yes.
lot of these products that help with melasma, they stop the enzyme, they block the enzyme that converts, it's tyrosinase inhibitors. They prevent the buildup of pigment called melanin, and that is one of the biggest reason why you get the pigmentation. And so things like hydroquinone, azelaic acid, retinol, niacinamide, these ingredients help lighten discoloration and pigmentation. And so in terms of hydroquinone, usually that's a prescription. You can get 2% hydroquinone in Dermabrite pads, which also have kojic acid. I didn't name that one, but that's a big one. So,
Mhm.
what would a melasma regimen, for example, look like? A gentle cleanser in the morning. I would use something like Dermabrite pads to tone because they have all these natural brighteners plus the option to add a hydroquinone.
Mhm.
And then a vitamin C serum, something like Illuma
Yes.
C, that's the pure active form of ascorbic acid. And then a tinted SPF moisturizer. With melasma, the less products, the better, because irritation and, that layering can flare up the condition. Anything that causes disruption in your skin barrier can flare it up.
Unfortunately.
And then maybe once a week, skip that and do a glycolic acid, toner. And so if you did that, that's a great morning regimen. At night, I would use the same gentle cleanser and then a really good retinol with maybe a moisturizer that has niacinamide in it would be great. I love Restore because it has niacinamide, it has resveratrol, it has green tea, which also help with melasma. Yet it's fragrance free. It's free of a lot of, irritating preservatives. You really want to make sure that your skin barrier is as strong as possible when you have melasma, because you're using all these, actives, and you really need a strong skin barrier. So that would be a good regimen. Retinol at night, and then, some comprehensive products like that in the morning. It's just sun protection. There's also other ingredients that we didn't talk about. There's so many. There's tranexamic acid, which Pharmacy Beauty just came out with a 3% tranexamic acid. There's also a product called cysteamine, which is Cispera, and that is something that's available through your dermatology office. And it's something you put on. It doesn't smell that great. You put it on at night, you leave it on for 15 minutes, and then you wash it off. So Cispera, there's Litera, which is tranexamic acid.
And SkinMedica just launched a newer version. It's 6 times, where Litera is 3 times tranexamic acid. They have
6%.
Correct. I forget the name. So, but we're going to start carrying it at the office too.
Yeah. So if you at a dermatology office, you'll have a lot of options. Alpha Ret, again, has a AHA along with a retinol. I love glycolic acid for melasma. It just brightens the skin, but you don't want to do it too much. I favor it once or twice a week.
Yeah.
So there's a lot of different options. So luckily we have a melasma regimen on our site that is very effective. And sometimes, though, you need a prescription. And when you need a prescription, you go see your dermatologist. If you can't see your dermatologist, check out Skin Bright. It is a program through our office that helps with treating melasma through a medical regimen, a medicated therapy that helps clear your melasma. And if you check out the site, you'll read the patient testimonials. We've seen so many people come in and they're like, no, I've already tried retinol, it didn't work. I've already tried hydroquinone, it didn't work. It's not just the product or that one ingredient. It is the entire regimen, and it is how you use it, the steps, the formulations. There's a lot more that goes into it than just, a single ingredient that you didn't see results from.
Seeing these patients struggle and then coming in and seeing how amazing and how drastic of results they get, and they're
so
just
gratifying,
so happy, and it just makes you want to cry. Just game changer.
I know. They come in and they're they have a little skip in their step. They've done their makeup, they have their lashes done, and people always comment, they're like, oh my God, she's like a whole other person. Is that the same person? Because they've colored their hair, they've done, started taking care of themselves, because something that's been holding them back for so long is no longer an issue in their life. And so it is honestly, I'm getting goosebumps. It is my favorite part of my job. It's
100%.
That's my goal.
Yes.
Is for these transformations. Thank you, everyone, for tuning in. If you found any value in this podcast, please share it with a friend, because sharing is caring. And your subscriptionship and your listenership really means the world to us. It is what keeps the podcast going.
Yes.
And if you're on Instagram, take a screenshot, share it to your stories. And if you are not on social, but you want to ask us questions, then send us an email at morethanaprettyfacepodcast@gmail.com or a message on Instagram. Thanks, guys, for tuning in.
Bye.